Good evening. My name is Martin Seers. I'm a GP. I'm a GP here in Christchurch and also am the chair of Pegasus Health, which is an organisation representing the majority of general practices, GPs, practice nurses and their teams for the whole of Canterbury. Thank you very much for coming out on a lovely evening, though cold, to come and hear what for many of us is a very passionate thing that we'd like to talk to you about. Once again, I'm not here to advocate for abstinence or for prohibition, but I think that I would like to describe to you the changes that alcohol has on our communities and the effects that it has on the family and the individuals, and ask you for your help. The more I've got to know about the alcohol issue, the more I realise just how big an issue the politics of this is. The alcohol industry is utterly enormous. In the last 20 years has grown into a very, very multi-billion-dollar industry. And that industry pours an enormous amount of effort and time and energy into creating the outcomes that that industry is seeking, which is better return on investment and profit and so on and so on. And so the industry lobbies extremely hard, and a lot of that is obvious and a lot of that is below the radar. And I think that's part of the reason why there's a bunch of reasonably passionate people wanting to talk to New Zealanders and Parliament and so on to try and address some of that balance. I think the main point I want to get across to you tonight is that the effects of alcohol are essentially an iceberg in our community. Later this evening you'll hear from Jan Bone at the emergency department, from our colleagues who manage the ambulance services, our police and others who will talk to us about the obvious top end of that iceberg, the really visible bit, the people being maimed and killed on our roads, the downstream effects of that violence that happens to our people. In general practice, of course, we see that stuff, but to us we see the other part of the iceberg, the bit that's underwater, and I want to try and describe a little bit of that to you to give you a sense of that. Below the water we have a pervasive impact of the effects of alcohol. So we need to understand a little bit about that. What is it? Well, it's a social relaxer, it increases confidence, it decreases stress and anxiety, and for that reason it's used and often used in a perfectly reasonable manner. It's also a depressant, and so the way that the alcohol chemical works, medium term, is that it actually promotes and causes depression. And the other interesting thing, as we think about the clips that we've just seen and the things that you're about to see, is that we have an expectation that people will make wise decisions about alcohol, and yet alcohol has its effect on the very organ that we're asking them to exercise to make those wise decisions. I think that's an important point to make. It has an enormous impact, as many of you I'm sure will understand, on our communities, our families, and right down at our individual level. It is, and we see this in general practice and primary care, it is the major cause of relationship issues and family breakdowns, violence, physical, sexual and emotional abuse that happens within families and within neighbourhoods. And that has a cascading effect down through families, social structures, and it contributes to real problems of having the children, our future generations, growing up in families which are dysfunctional, where families are no longer operate in a supportive manner with the normal supports that we expect. That has a downstream effect on the mental health of not only the adults but also the children who are growing up. The education, the ability of the children to actually go to school and learn the stuff that we need them to know to be the next generation. Also has an effect, of course, on work as families break up, and the effects that happen on depression and stress, lost time from work and so on. Also has an effect on the family networks, relatives, employers and so on. And for us in general practice, that's a very day-to-day thing, and we see the outcome of that in mood disorders, in violence, in people coming in with a whole range of disorders that are related to alcohol. And for us, that's a very major part of what we do. And so we're very passionate about trying to actually think about what are the drivers for that change in behaviour. If you think about alcohol's use, think of it on a spectrum from one side of being safe use of alcohol, and we will understand the other side, which is addiction. And I think for a lot of people there's a simple wall between those two things, safe use and addiction. Well, I'm not an addict, therefore I must be safe use. But in actual fact there's quite a spectrum in between there. From safe, it moves through an area of hazard, through to problem, through to dependency, through to addiction. And what we find as we do more and more research on alcohol and its effects is that many people who think that they are drinking in the safe area, in actual fact, are in the hazard, the problem, and the dependency area. And a number of really good bits of research done in New Zealand suggest that that number is in the region of 700,000 people. That's 700,000 people. That's more than the entire population of Canterbury. That is enormous. So is this a minor problem? No, it's a huge problem. It's a huge problem that as a country we need to try and understand and then think about the solutions that we can put in place for that. The organisation that I work for, Pegasus Health, and the PHO that it operates with, Partnership Health, got together a group of interested people and put together a submission to the Law Commission review on the effects of alcohol and the view of general practice and primary care. When that was in its draft form, we sent that out to our practice teams and said, would you like to comment on this? Over 140 individuals wrote back in personal statements of support of that submission. Now, that may not seem a lot to you, but believe me, doctors do not like writing stuff. They don't like getting together and supporting causes and that sort of thing. For us, this is an absolutely fundamental shift in the way that doctors, nurses and others behave. And the reason I'm describing it to you is this is not something that we're unsure about. This is something that the people who care for you, your doctors, your nurses, your midwives, those people are saying this is a problem, we do need to do something about this. It is an unprecedented response, and I ask you to consider that. So what am I asking for you as to take home messages tonight? I'm asking you to think of alcohol as the iceberg. You'll soon hear of the details of the tip of the iceberg, but really do consider the bottom part of that. I want you to understand that I'm speaking here as a representative of general practice, GPs, practice nurses, and the midwives of Canterbury are asking you to hear this message. We genuinely think that there is a problem here and we need a groundswell of support to achieve that change in the laws governing the alcohol. There's an enormous amount of evidence out there about alcohol and the harm that it's doing. And there's a lot of people out there who are suggesting that there isn't, that we need to know more about that. It's not true. My final request to you, with the bells tinkling in my ear, my final request to you is please do your part in helping us to achieve that. Please, each of you, if you will support what we're saying, contact your MP and support them to make the changes to the national things which will make a difference to alcohol. The availability of alcohol, the price, the times when it's available, the age of purchase, the 5+ that has been very clearly supported by the Commission. Thank you very much.